Gambaran simbolon. Dokter Yusah Herwanto, spesialis THTKL, K. Based on data obtained from research by Abdullah, 2003, in January to December 2000 at the THTKL Polyclinic. H. Adam Malik Hospital Maidan found that cases of this disease are still quite high and have increased in various other hospitals. For this reason, the topic of otitis externa is an interesting topic to study in the writing of this review. The purpose of this paper is to find out and understand about otitis externa. The benefits of writing to improve the writer's knowledge and skills regarding otitis external. Anatomy of the outer ear. The outside is divided into two parts, namely the part that protrudes from the side of the head, auricle or pinna, and the canal that moves inward, external acoustic meatus. Otitis externa is an acute or chronic inflammation of the skin of the outer ear canal which is usually caused by bacteria, fungi and viruses. Acute otitis externa is divided into two, namely circumscript otitis externa and diffuse otitis externa. Otitis externa circumscripta is an infection originating from the hair follicles in the ear canal caused by staphylococcal bacteria and causing furuncles in the outer one-third of the ear canal. Often occurs in someone who has diabetes. Diffuse otitis externa is an infection in the inner two-thirds of the ear canal due to bacterial infection. The most common causative bacteria are Pseudomonas. Chronic otitis externa. Symptoms that occur in chronic otitis externa are the same as acute diffuse otitis externa, but occur in a longer duration, which is more than 6 weeks. The most common cause is a bacterial or fungal infection that is not treated properly. Clinical symptoms. Fullness of the ear is a common complaint in the early stages of otitis externa diffuse and often precedes the occurrence of aches and tenderness. Diagnosis 1. History. 2. Physical examination. 3. Examination with otoscopy. 4. Simple hearing test. 5. Supporting examination. 6. Bacterial culture examination. 7. Comparative diagnosis. Diffuse externa otitis must be treated in early conditions so that it can eliminate the edema that clogs the ear canal. Therapy depends on the state of the furuncle. When it has become an abscess, it is inspired sterile to issue pus. Local is given antibiotics in the form of ointments, such as polymyxin B or bacitracin, or antiseptic, 2 to 5% acetic acid and alcohol. External otitis is a condition that can be treated, usually heal quickly with the right treatment. Most often, otitis externa can be easily treated with antibiotic eardrops. Chronic external otitis, which may require more intensive care. External otitis usually does not have long-term or serious complications. Conclusion. External otitis is an acute and chronic inflammation of the outer ear canal that is usually caused by bacteria. Fungi can be acute or chronic. Factors causing the emergence of external otitis include humidity, ear canal blockage, local trauma and allergies. External otitis is classified into acute external otitis and chronic external otitis. Otitis external treatment is quite simple but requires compliance with sufferers. especially in terms of maintaining the cleanliness of the ear canal. Management can be given topical and systemic antibiotics. Corticosteroids can also be an option. And given analgesic drugs to reduce pain. Thank you.
Terima kasih. Arigatou gozaimashita. Gracias. 谢谢。